6.78 to 7.19. And a little bit about that, the p-values was less than 0.05, significant difference between the change with the non-diabetic, with the diabetic population. And they did say they weren't on a controlled diet, but they did mention they were on a low-fat diet. So saying like 21% protein, 30% fat, and 46% carbs. So something that they were just mentioned on that. The second study, which was sung, and a little bit about sung, this was now included men. So this was women and men, and this was 40 participants. This one, however, was more time, which was 6 months. Their age was over 65 years old. And their focus was, let's see what walking has on diabetes. BMIs were a little bit over 25. And they had 22 do the experiment and 18 a control group. The 18 participants in the control group saw increases in their hemoglobin A1c. But let's focus on the 22, in the experiment group. They started, so the pre-test right here, it was 7.58, so a little less compared to the other study. And mid-test, they took it at 3 months, and they saw a decrease of at 7.32, and then after 6 months, they saw a decrease of 7.17. And a little bit about this program. So this was not self-paced. This actually, they require them to reach a certain intensity, and they said, all right, let's do normal for 30 minutes, 55 to 64% heart rate max. And then that was after a month, and then they increased it, a brisk walk, 35 minutes, 65% to 75% heart rate max. And that's when they actually, going at 7.58 to 7.17, 6 months, and actually at going at a brisk walk, they saw a better decrease. Our recommendations, we said, was self-paced brisk walk, working up to 65 to 75% heart rate max for at least 50 to 60 minutes per day, 3 times to 5 days a week. Continuing this regimen for 6 months will cause a decrease of 0.5 on average over a 6-month period for people with a baseline of 7.5 and higher. And last, with people with baselines below 7.5, should supplement a walking program with resistance training, which we'll speak a little bit about later.
So going along with what we've covered so far, we've talked about yoga, how it has its benefits, and we've talked about walking. Now we want to focus more on resistance, aerobic, and then the combination of the two. As we saw in the very beginning, we saw that combination of aerobic and resistance gave us the greatest results. What we're going to explain now is why, and we're going to get more into frequency and intensity of those exercises so we can see exactly how those affect our HbA1c levels. Going on, wrong button.
No, not delete, no.
So this is a study that we had in all the studies that we read that focused on 4 different groups. One of the groups was assigned to do just aerobic training alone. Another group was assigned to do resistance training alone. And then there was a control group in which they didn't do any exercises. And then we had the combination of both, which did aerobic and resistance. On the top, we can see right here that that's the control group. So this study lasted for a period of 9 months, which was one of the longer studies that we had. And they measured their HbA1c levels throughout the study. And as you can see with the control group, they started out just above 7.6, and by the end of 9 months, not doing anything, obviously their levels, they're not going to get better, but they got a little bit worse. So that's with the control group that didn't do anything. The next one down, we've got resistance. And in general, you can see they started up between 7.5 and 7.6, so getting to that range where it's easier to decrease. And as they went through the 9 months, you can see overall they had a decrease with their resistance training. And then the same with aerobic, just below them with the triangles. Overall, they started out just right about 7.5, and by the end they did have a slight decrease. But the one that we can see the most significance, like we saw in the beginning, the p-value that was significant, is the combination of the two. They started out just about right where the other ones were at, but by the end, they ended up just right around 7.3 or a little bit lower than that, which gives them about looks about like a negative 3% decrease, kind of what he was explaining. So it brings them from a 7.55 down to about a 7.27, which is a really good decrease over the period of 9 months. So that's something to keep in mind, the types of exercises that they were doing, and just to take note, that combination did have the greatest decrease in this study.
So as Dylan said, we're going to go into aspects of frequency, intensity, duration, things of that nature. So frequency of aerobic training, there's a very important study that was done by Dr. King and his associates, and they took 7 men and 2 women. And these people were not diabetic, but the purpose of the study was to measure how long increased insulin sensitivity due to exercise, how long that lasts after the exercise is performed. And so they had them perform aerobic exercise, and then they measured how long that increased sensitivity to insulin would last. Obviously, this is going to be very important for diabetic people because they are type 2 diabetics have insulin resistance. So the more sensitivity they can get to insulin, the better. And so with this study, they found that increased insulin sensitivity due to exercise lasted no more than 3 days. And what that translates to for frequency of aerobic exercise is that no more than 2 days should lapse between each bout of aerobic exercise. And we'll get into intensity a little bit more. That'll help explain frequency. But our recommendation there is 3 to 5 times per week. And as far as resistance training goes, we recommend 2 to 3 times per week. And our next slide is going to have, if you don't mind going to the next slide, these are all the studies that I looked at for frequency. Virtually every single one of the studies we looked at for resistance training, as we were studying this topic, had their participants exercising 3 times per week. So they did resistance training 3 times per week. And these are some of the results they had. Over here on the left, well, yes, it's on your left, the people with baseline of over 8%, their hemoglobin A1c baseline was over 8%. And over here on the right, baseline below 8%. The really significant thing to see in this slide is that over here on the baseline over 8%, almost all of these groups had a significant decrease in their hemoglobin A1c levels. So this Siegel study that we've already talked about a little bit, their participants started with a baseline of 8.29%, and after 6 months of doing this 3 times a week strength training exercise, they had a drop of 0.49, which was not statistically significant. You see the p-value is 0.094, but it's still a pretty good drop, especially when compared to 0.09 and 0.35%. So in the next study, the Castaneda study, they started at 8.7, and by the end they dropped 1.1%, which was of course statistically significant. Sorry, I can't talk. And this Dunstan study down here, their study lasted for 6 months, and again they dropped 1.2%, which was very statistically significant. That's one of the most impressive drops we've seen. And the reason we attribute that to their subjects were put on both a resistance training regimen and a weight loss program. So this was a diet for them to lose 1 pound a week, 0.45 kilograms per week, which is a pretty good diet. And by the end, they had a very significant drop. So by this, we definitely recommend 3 times per week of resistance training. And we'll go a little bit more into our overall recommendations at the very end.
So we started gathering our studies, and we saw our studies at least, to see a change in hemoglobin A1c, it takes at least 3 months to change. So,
Should you speak up?
oh, sorry. So we gathered our studies, and we put them together, and we saw that to see a change in hemoglobin A1c, it has to be at least of 3 months. And we just took our studies and saw programs of lasting over 3 months. Optimal duration of exercise varies based on intensity, which we'll speak later in our presentation. But in this next, we just gather our studies, we put them on, depending on the duration, from 3 months to 9 months, their pre and post values and the type of exercise they were doing, whether it was combo, which means aerobic and resistance, yoga, walking, or just resistance or alone. And just like we noticed, like they all saw different like decreases, and depending on their baseline, of course. Like Kai was saying, the one that really caught our attention was Dunstan at 6 months, going from a pre-value of 8.0% to 6.8%, and doing resistance plus the weight loss program that they were. So just a little bit more, we just recommend at least having one of 3 months and then just keep increasing. And we'll talk about intensity with the different intensities of these groups.
We had a look at aerobic, the intensity that aerobic exercise should be performed at, and the intensity that resistance training should be performed at. And for aerobic exercise, there was a rather impressive study done by Dr. Hansen, and I looked into it. They did control for volume in the study. Thank you, Brother Langford. So, this is a 6-month-long study in which they took 50 participants, and they split them in half. They said, 25 of you are going to perform 55 minutes of aerobic exercise 3 times a week at 50% of your VO2 max. So they're doing 55 minutes. And the other group was doing only 40 minutes 3 times a week, but they were performing at 75% of their VO2 max. Now, by the end of this study, by the end of the 6 months, of course, both groups have performed the same volume of exercise, but one of the groups, the high-intensity aerobic training group, had performed a full 18 hours more of exercise. That's just the added up 15 minutes each time over the...
Yeah, the moderate intensity had done 18 hours.
Oh, sorry, yeah. The moderate intensity had done 18 hours more than the high intensity. Thank you. Yeah. But by the end of the study, both groups started at 7.2. That was their baseline. By the end, they had dropped to 6.9. And they both had a significant decrease, and there was no significant difference between the two groups. So what that translates to is, for people who have less time in the day, for people who have less time to exercise in the day, they should be exercising at a higher intensity if they want to see the same gains. And so we also looked at resistance training. So we have 2 studies here performed by Castaneda and Dunstan, and we've already talked about these studies a little bit, but these studies were performed. They performed resistance training. They started out the subjects in this first study at 60 to 80% of their 1 rep max, and they were doing several different exercises, 5 different exercises, 3 sets of each, and they saw a decrease from 8.7% to 7.6%. And this next study, well, they worked from 60 to 80 in the beginning, and then they went from 70 to 80. And in this next study, they started out their subjects at 50 to 60% of their 1 rep max. And by the end, from weeks 3 on, they had them exercising at 75 to 85% of their 1 rep max. And so both of these studies were kind of doing the high intensity, and both of them had very significant decreases in their hemoglobin A1c levels. And once again, that Dunstan study did include a weight loss program, which is why the drops were so big. All right, so our recommendations for intensity. For aerobic exercise, we recommend 120 minutes of high intensity exercise per week, and the optimal for this would be performed 3 times, 3 different bouts of 40 minutes. That equates to 120 minutes at 75% of your VO2 max, or 150 minutes of moderate intensity exercise. So this is 5 days a week, 30 minutes each session, at 50% of your VO2 max. And for resistance training, we recommend 8 to 10 reps at 70 to 85% of your 1 rep max on 7 to 9 different exercises. And I did have some examples of the exercises here, but I see now that they've been deleted. So. But they're also included at the end, so don't worry about it. Stay tuned.
So we wanted to address medication and diet just very briefly. Obviously, this is not the focus of our study. We focus mostly on exercise. But we ran into just one study that controlled for diet, only one. And we've already talked about it a couple times. It's the Dunstan study. And it showed greater decreases than any other study that we ran into. A 1.2% decrease in their hemoglobin levels, which is comparable to the combined exercise programs, which we've seen the combined exercise programs are much greater than resistance. But with this group that was doing, much greater than aerobic or resistance, and this group that was just doing aerobic with a low-fat diet saw the same decreases as the people in the combined exercise group. And then when it comes to medication, there was a study done by Gerstein, and their median hemoglobin levels were 8.1%, and they dropped to 6.7% in just 4 months. I forgot to put 4 months in there, but they dropped from 8.1 to 6.7 in just 4 months. In the intensive group,